How am I going to present when it comes to community setting in my OSCE presentation? How will I present or how will I talk to the patient when it comes to the community setting scenario? In the three-step approach, you can either get a community setting or a hospital setting. This is how you are going to go about when you get a community setting scenario. The scenario states that you are a community nurse, go and administer inhaled medication to your patient in their house, or if it's a care home, you are going to administer a specific injection to the patient in their care homes. So it can either be their home or you go to the care home to administer whatever medication that has been requested of you. So when it comes to the community setting, this is how you are going to go about the community setting three-step approach. You start by saying, obviously, you are entering into somebody's home. So you wouldn't want to just go ahead and enter. You would want to go and make sure that you be polite as possible. You are going to go about and say, knock, knock. Am I in the address of Miss Araba Lawson? Can I please come in? Yes, you can. Okay. I will ensure scene is safe. I'll provide privacy and dignity. So this is demonstrating that as you are entering into their room or their house, you ensure the scene is safe. And then you provide privacy. If you are going to knock, it means you shut the door behind you. That will demonstrate that you are going to provide privacy and dignity for the patient. And then you perform a quick hand hygiene following the 7 steps of WHO guidelines. So palm to palm. Hello, my name is Obapre. I'm your attending nurse for today. Can you please confirm your name, date of birth, and your first line of address? My name is Araba Lawson. My date of birth is 10th March 1945, and my first line of address is 1 May Road. I can confirm I'm with the right patient. How would you like me to address you? All right, Araba, do you have any allergies? And if yes, what are your reactions? All right, you don't have any allergies. Okay, I will note that. Araba, are you comfortable or are you in any pain? You are comfortable. Okay, thank you very much. I'm here to administer your prescribed inhaled medication, which is due at 2 o'clock. Is it the right time and are you happy I proceed? All right, can you give me a place to assemble my articles? You can use the table over there. Okay, if you need me, kindly give me a shout and I will get back to you. This is how you're going to do the step 1 approach for a community setting. Mind you, the patient has no call bell. You are not going to leave any call bell for them. You are just going to tell them if they need you, they should give you a shout. As soon as you finish the step 1 approach, you perform your quick hand hygiene and then you leave to go and gather your articles. If there is a validation of prescription, you go ahead to do that, which also comprises with the step 2. And then the step 2 also comprises of the ID checks that you are going to do again, because you need to do a second ID check when you get back to the patient. That is the step 2. And then you go ahead to perform the procedure, which is the administration of inhaled medication. I'm done now. I need to do the closing statement. When it comes to a community setting, how do we go about with the closing statement? I'm done with the procedure, Araba. Do you have any questions or any concerns? No? Okay. Thank you very much. Are you comfortable? I'm going to be here in the next 30 minutes to monitor the effectiveness of the medication. If I'm away and you have any concerns, please contact your GP. If it's out of hours, call 111. And if it's emergency, call 999. Is that okay? All right, thank you very much. I will discard my article, clean my tray and make it ready for the next use, and then I'll perform my hand hygiene. If you need me, kindly give me a shout. All right, thank you. So this is how you go about the closing statement for community setting scenario. When it comes to documentation for every station, if the station comes with your appropriate documentation that you need to do, please make sure to do it before you talk about escalating, you talk about the education. After you ask them, do they have any question or any concerns, just go straight ahead. Can you give me some few minutes to do my documentation? and then you document appropriately. This will save you from failing the station, because if you go ahead and talk a lot, 30 seconds that will be remaining can probably not document everything you are supposed to document. In order to avoid failure, make sure that you do your documentation before you go straight ahead to talk about the closing statement. That is how you are going to do the closing statement, the step 1 for community setting. You are not going to use a call bell. You are going to verbalize to the patient to give you a shout when they need you. And also when it comes to escalating, if they have any concerns, they have to call their GP. If it's out of hours, it's 111. And if it's an emergency, it's 999. So that is how the community setting preamble looks like. Thank you so much for watching this video. Make sure to subscribe if you haven't. Click on the notification button to be informed whenever I post a new video. And also share this to your OSCE buddies. Leave a comment and make sure to like this video. Thank you, and let's pass together.